Alright, let's get started on breast surgery. Mammary glands consist of 15 to 20 lobes embedded in fibrous and adipose tissue. Each lobe extends into excretory ducts which drain into what structure? The excretory ducts from each lobe drain into the lactiferous sinus, which is found deep to the nipple. So the excretory ducts drain into the lactiferous sinus. Next question. The tapering of breast tissue into the axilla is known as what? The tapering of breast tissue into the axilla is known as what? The tail of Spence. What is another name for the suspensory ligament of the breast tissue? What is another name for the suspensory ligament of the breast tissue? Cooper's ligament. What four nerves are at risk during axillary dissection? What four nerves are at risk during axillary dissection? First, you have the long thoracic nerve. 2, thoracodorsal nerve. 3, the medial pectoral nerve. And lastly, the lateral pectoral nerve. So again, the four risks that are at risk during axillary dissection are going to be long thoracic, thoracodorsal, medial and lateral pectoral nerves. Damage to the long thoracic nerves results in atrophy of what muscle? It's going to be the serratus anterior muscle. What is the superior boundary of the axillary dissection? What is the superior boundary during axillary dissection? Axillary vein. What is the posterior boundary during axillary dissection? What is the posterior boundary during axillary dissection? Long thoracic nerve. What is the lateral boundary during axillary dissection? What is the lateral boundary during axillary dissection? Latissimus dorsi. What are three arteries that supply blood to the breast tissue? What are three arteries that supply blood to the breast tissue? You have the axillary artery, the internal mammary artery, and the intercostal arteries. What are three veins that provide drainage for the breast tissue? Three veins provide drainage for the breast tissue. You have the axillary vein, the internal mammary vein, and the intercostal vein. Describe the medial and lateral lymph node drainage of the breast. Describe the medial and lateral lymph node drainage of the breast. Lateral drainage occurs through the axillary lymph nodes. Medial drainage occurs via peristernal nodes that run parallel with the internal mammary artery. So laterally goes through the axillary lymph nodes, and medially occurs via peristernal nodes that run parallel with the internal mammary artery. Name the 5 groups of contiguous lymph nodes removed during a radical mastectomy. What are the 5 groups of contiguous lymph nodes removed during a radical mastectomy? You have the subclavicular group, the central axillary group, the axillary vein group, the scapular group, and the external mammary group. So that was subclavicular, central axillary, axillary, scapular, and external mammary groups. What is the BI-RAD system? What is the BI-RAD system? A classification system that allows for categorization of breast tissue density. This system stands for Breast Imaging Reporting and Data System. What are the 5 types of malignant breast lesions? What are the 5 types of malignant breast lesions? And which is the most common? First, you have lobular carcinoma in situ. Then you have ductal carcinoma in situ. Third is infiltrating ductal carcinoma. Fourth is infiltrating lobular carcinoma. And lastly, you have tubular carcinoma. So again, you have lobular carcinoma in situ, which is a marker of increasing risk of developing either ductal or lobular carcinoma. Then you have ductal carcinoma in situ, which is a pre-invasive form of ductal cancer. Then we have infiltrating ductal carcinoma, which is the most common type. You have infiltrating lobular carcinoma, which is difficult to detect. Lastly, you have tubular carcinoma. So remember, the most common type of malignant breast lesion was infiltrating ductal carcinoma. What is the most sensitive and specific imaging test for the diagnosis of breast cancer that is currently used? Mammography. When is a CT scan used for breast cancer diagnosis? Or for breast cancer imaging, it's better worded. It is used post-mastectomy to evaluate the chest and axilla. It is also used for imaging of the internal mammary nodes. What is the imaging method of choice to evaluate for ruptured breast implantations? What is the imaging method of choice to evaluate for ruptured breast implants? MRI. MRI may also be used for the staging of ductal carcinoma in situ, as well as lobular cancer. MRI also provides benefit for dense breast and those with scar tissue. So to review, MRI is the method of choice for evaluating for ruptured breast implantations, for really dense breast, and those with scar tissue. It is also beneficial for staging of ductal carcinoma in situ and lobular cancers. What are the 4 factors to consider during the staging process of breast cancer? What are 4 factors to consider during the staging process for breast cancer? Estrogen receptor status. Number 2 is histopathologic grade of the tumor. Number 3 is mitotic index. And number 4 is going to be HER2 oncogene status. So the 4 factors to consider during the staging process of breast cancers includes estrogen receptor status, histopathologic grade of the tumor, mitotic index, and HER2 oncogene status. What is a monoclonal antibody that can be used to treat HER2 positive patients? Herceptin. Compare and contrast the 4 different types of breast cancer surgeries. So you have lumpectomy, which is the removal of the lesion only. Then you have simple mastectomy, which is the removal of the affected breast only. This includes the entire breast, skin over the breast, the tail of Spence, and the pectoral fascia. This involves no axillary dissection, but it will include radiation following surgery. Then you have a modified radical mastectomy, which is the affected breast is removed, as well as level 1 and level 2 of the underarm or axillary lymph nodes. Remember, there are 3 total levels. Level 2 lies deep to the pectoralis minor muscle. Level 1 is inferior to the pectoralis minor muscle, and level 3 is superior to the pectoralis minor muscle. Last, you have the radical mastectomy, which involves removing the entire breast, all 3 levels of the axillary lymph nodes, as well as all underlying chest wall muscles. A lumpectomy can be used for what 2 types of breast cancers? A lumpectomy can be used for what 2 types of breast cancers? Ductal carcinoma in situ and invasive carcinoma. Lumpectomy can be used for ductal carcinoma in situ and invasive carcinoma. What are 2 complications from breast surgery? What are 2 complications from breast surgery? Lymphedema, as well as paresthesias or pain to the central or posterior aspect of the arm and axilla. This is caused by injury to the intercostal brachial nerve. How do you treat lymphedema? How do you treat lymphedema? You could use a combination of external pneumatic devices, an elastic garment, exercise or massage, or diuretics. What medication can be used in estrogen receptor positive women and for what duration? Tamoxifen, which is given for 5 years. What chemotherapeutic agent can lead to cardiotoxicity? Doxorubicin. What is a potential reason you may want to delay reconstruction surgery following a mastectomy? What is a potential reason you may want to delay reconstruction surgery following a mastectomy? To allow for increased penetration during radiation therapy. What are 2 types of breast reconstruction? You have saline-filled implants, as well as autologous tissue transfer flaps or tram flaps. What is a tram flap? A tram flap is a transfer of a section of skin, fat, and muscle, along with its attached blood supply, to the chest wall. This serves as a new breast. The tissue selection can be used from the abdomen, which are the rectus muscles specifically, or the back muscles, specifically the latissimus dorsi. A benefit for utilizing the abdominal or rectus muscles is that you get an effect of a tummy tuck-like appearance. And that's it.